Hello friends, myself Dr. Samrat Jankar, Advanced Laparoscopic, GI and Colorectal Surgeon, Kaizen Gastro Care, Pune. Post-surgical care after a surgical myotomy in case of Achalasia Cardia. Achalasia Cardia is a disease which is treated either by endoscopic myotomy or laparoscopic myotomy. This can be done very well by the surgeon. On the table, we can make sure that we have done adequate myotomy. As a result, patient will have very good post-operative recovery. If surgery went uneventful, usually second or third day patient will get discharged. Before discharge, surgeon may do some dye study to see that is there any leak, and also how the fluid or how the contrast is flowing, that can be identified. Patient himself or herself is the best to judge about the surgical result, that prior to the surgery patient is not able to swallow anything, but after surgery the patient starts swallowing the water, patient become very comfortable and the results are amazing. We need to understand that in case of any kind of myotomy, we are cutting outside layers of esophagus. Only mucosa is limited, in particular 6 to 8 centimeter where myotomy done by endoscopic or laparoscopic. So only one layer is there. You need to be careful what you are eating, how you are eating, and what kind of stuff you are eating. We should be very conscious after the surgery eating pattern. Initially maybe 2 to 3 weeks more liquids or soft diet can be taken, but over the long period of time we need to make sure that we are eating the food which is chewed very well in the mouth, and we are swallowing slowly, consciously, not talking or not seeing the TV or not reading newspaper and eating. That habit should be stopped after myotomy. We should be conscious of our food intake, and we should swallow properly and slowly, and one by one bite we should take slowly. Also, we should be very conscious about eating very hot item. We should avoid eating something sharp objects, such as sometimes you are eating non-veg, some bone may go inside, or sometimes particularly fish bone which may go inside, which should not go in and make the injury to mucosa, and that may lead to a perforation, should be avoided. Frankly speaking, no treatment mean to correct the basic problem. So you should be very much close follow-up with your surgeon, so that if there is any recurrence, it should be identified early and get corrected by some different means of treatment. And also some degree of reflux in laparoscopic or endoscopic surgery, if it is there, you may need to take long-term antacid treatment, so that acid reflux should not affect your long-term quality of life. Thank you.